afternoon, Chair Mehevic, Dr. McEwen, and members of the Board of Health. My name is Meena Bhardwaj, and I'm part of the Youth Health Action Network, commonly known as the YHAN. The YHAN is an established group of youth comprised of youth from across the city of Toronto. We are passionate on taking issue on health issues that affect young Torontonians, namely in the area of tobacco control. Thank you for the opportunity to present a response to today's report. As youth, we commend the Board of Health for continuing to take actions to protect the public from the harmful effects of secondhand smoke. We support the proposed changes to the municipal and provincial legislation because we believe that additional measures are needed in order to protect the public, especially vulnerable populations such as youth. As youth, we spend much of our leisure time outdoors. We often go to patios for a meal, spend a day at the beach, attend outdoor sporting events, or just hang out at the park. When we share these outdoor spaces with those who smoke, we are unintentionally being subjected to secondhand smoke, which is slowly having a negative impact on our health. In the ideal situation, we'd like to be able to freely choose where we spend our time outdoors without having to worry about compromising our health. With the adoption of this report, we believe that this ideal can become a reality. As youth advocates for health, we also understand the need to reduce the visibility of smoking in public, as it normalizes the habit and undermines the successes of the Smoke-Free Ontario Act. By further limiting smoking in public, we believe that children and youth will be discouraged from picking up the habit, and those who have quit will be encouraged to stay quit. Although there is already legislation in place that addresses smoking in public, there are still a number of places that youth frequent that are not included in the current legislation. Alongside supporting this report, we'd also like to take this opportunity to raise the board's awareness to an emerging tobacco control issue within the city of Toronto. Water pipe smoking, also known as hookah and shisha, is a rising trend in Toronto amongst youth. Research shows that 36% of Canadian youth have tried water pipe smoking, and there are over 80 water pipe bars and cafes within the city of Toronto alone. Due to a result of a gap in current legislation and challenges enforcing this legislation, water pipe smoking, both tobacco and non-tobacco products, exposes people of all ages to its potentially harmful effects. As youth, we are concerned about the issue of water pipe smoking indoors for a few key reasons. We've conducted informal street interviews with youth, and we've confirmed our suspicion that youth are generally misinformed about the harmful effects of water pipe smoking. Water pipe smoking poses several health risks, including exposure to well-known toxins from secondhand smoke when both tobacco and non-tobacco products are smoked. We believe that youth are being targeted through cheap costs, the wide variety of flavors, and its proximity to schools. There's also been an integration of water pipe smoking into post-secondary culture. Ryerson University actually recently had a Frosh Week event where they supplied and encouraged first-year students to try water pipe smoking. As the Youth Health Action Network, we continue to raise awareness about the harmful effects of water pipe smoking. However, we urge the Board of Health to go one step further and take the following actions. We ask that you commission Toronto Public Health to compile a report highlighting the harmful effects of water pipe smoking. We also ask that you consider an amendment to Municipal Code 709, smoking, to include a more comprehensive definition of smoking so that water pipe is also included. Lastly, we urge you to request the Minister of Health and Long-Term Care to amend the Smoke-Free Ontario Act to include smoking of non-tobacco products in public spaces and workplaces. We believe it is dangerous to wait for what some might consider sufficient evidence before taking action on the issue of water pipe smoking. We strongly encourage the Board of Health to thoughtfully consider our recommendations and those outlined in the report today. By making entranceways and exits